Hello, welcome to Acharya Nidana Academy. Continuing with the bedside teachings or OPD or IPD teachings. So we have so far discussed some of the very important aspects as far as the chief complaints, how to identify the chief complaints related to different systems, and how we are going to analyze regarding the history of present illness as such. That means we're going to note or document the details of presenting complaints. And we have even discussed possible errors that can happen in recording the history of present illness. In this particular video, we are going to discuss some of the important points that will be discussed in past history. So this particular past history, some people, they will say it is the previous history. So what actually so this particular previous history or past history refers to? Actually, that is nothing but it is nothing but the details of the sufferings or the diseases which are present before the presenting complaints. Say, for example, a person is suffering from the loose stools since 3 days. He is also having pain in the knee joint since 3 months. So when you think about the loose stools and the joint pain is present well before the presenting complaint. This will be recorded in the past history or previous history. So that's what it is being mentioned here. An individual suffering from pain in the gastric region since 10 days. Then any illness which are or disease which are present before 10 days, that is coming under the documentation of previous history or past history. These are some of the examples that the person may have the illnesses prior to the presenting complaint. For example, pain in the knee joint, which may be considered to be osteoarthritis. Diagnosis may be osteoarthritis there. Previous history of breathlessness may be observed in bronchial asthma. Generalized abdominal swelling that is filled with fluid may be indicative of alcoholic liver disease. Ascites there. Pain in the right iliac fossa after appendectomy. So that means which is pain in the McBurney's point after appendectomy. If you are making the diagnosis again as appendicitis, then it will be a wrong diagnosis as such. In that particular situation, the possible diagnosis may be intestinal adhesions. Then the previous history of pulling the hair, etc. This is specifically on eating the hair, which is one of the psychiatric illness as such. That's what we can say. That is the anxiety or fear. So, which is the trichobezoar, which is nothing but the eating the hair, and that will be getting accumulated in the stomach itself. As far as previous history is concerned, following list have to be documented there. Childhood illnesses, medical illnesses, surgical illnesses, and psychiatric illnesses. Suppose if the person is of 20 years old, you have to inquire about the illnesses which are being present since his childhood. Any childhood illnesses may be related to the presenting complaint or any other illnesses have to be recorded. For example, any kind of the infections, respiratory infections, or otherwise any kind of the hepatitis or the liver infections, etc., that have to be discussed there. Or the measles, which is a childhood illness, mumps, chickenpox, jaundice, and bronchial asthma that have to be documented in the previous history. That too, in this is the category of childhood illnesses. When thinking about adult illnesses, there are further of three categories: medical illnesses such as diabetes mellitus, hypertension, hypothyroidism, epilepsy, and hepatitis, etc. Regarding the previous history related to surgical illnesses, history of appendicitis, phimosis, wherein the urethral passage that is going to get narrowed so that the urine will not be flowing in the male who is suffering from phimosis. Bleeding piles. So, or otherwise any major surgeries, cardiac surgeries, etc., that have to be recorded there. Regarding psychiatric illnesses such as mania, depression, or bipolar mood disorder, or any other illnesses such as anxiety, etc., have to be recorded. When you think about the different examples in relation to medical illness, so presenting complaint of hematemesis, previous history of jaundice or ascites is of prime importance because the diagnosis in that particular situation will be portal hypertension. Previous history of seizure attacks, wherein in between the attacks the person will be perfectly normal. That will be helpful in the diagnosis of epilepsy. Previous history of chest pain on exercise, that may be helpful in the diagnosis of ischemic heart disease. History of pain in the right iliac fossa in a patient of over 40 years with pain observed in the epigastric region and who is having the history of pain in the epigastric region. The diagnosis in that particular situation may move towards peptic ulcer perforation. Whereas development of the reduced strength on the body parts following excess administration of normal saline solution, when the person is having what you say that the vomiting or diarrhea, wherein the person may have hypovolemia and electrolyte imbalance, administration of excess normal saline may move towards the present the clinical features of or manifestation of the disease, motor neuron disease. 50-year-old male presented to the OPD with profuse sweating, wherein the person is bending forwards, the forward bending posture, what in Ayurveda that is being said vinama, and acute retention of urine was also being present for almost 6 to 7 hours. The person did not pass the urine. When you think about it, the diagnosis may move towards benign prostatic hyperplasia or prostatic enlargement or prostatomegaly. Previous history of hypertension may help in the diagnosis of left ventricular hypertrophy or left-sided heart failure if the person is having the presenting complaints of left ventricular dysfunction. Wherein previous history of diabetes mellitus may help in the diagnosis of diabetic retinopathy if they are having vision disturbances, diabetic nephropathy if they are having urinary disturbances, and diabetic neuropathy if they are having sensory disturbances. When you think about surgical illness, as far as previous history is concerned, 6-year-old male presented with fecal incontinence. On inquiry, he went to the operation of bleeding piles. On one particular post-operative day, the person was having the constipation that was being managed by forceful extraction of fecal matter through the anus. This led to anal sphincter Thus, fecal incontinence has been developed. So here, the previous history of operations related to the bleeding pipes that is being considered to be of importance. Whereas 30-year-old female presented with the pain in the right iliac fossa, who is having the history of already appendicectomy was being done, in that particular situation, the diagnosed appendicitis cannot be made. So in that situation, the diagnosis may move towards intestinal adhesions. Whereas 60-year-old male presented with altered state of consciousness, who is having a chronic non-healing ulcer in the left lower limb, in that particular situation, the diagnosis may move towards septicemia. When you think about psychiatric illnesses, so these are the few examples wherein we have to inquire about anxiety towards crowd or height, and anxiety towards facing examination, or otherwise panic attacks while seeing some other fearful situation, etc. And previous history of depression, mania, mood disorders, etc. that has to be inquired. So the take-home messages from today's discussion are: past history or previous history are nothing but the part of the history taking wherein informations are documented which are indicating the ill health prior to the presenting complaint. This may be related to either the absence of previously manifested disease, or it may be associated with the presenting complaint. That means when the person is having the presenting complaint, he may have the already pre-existed disease, or he may not have that particular disease. So this may be categorized under childhood illnesses till date, or the medical illnesses a person is suffering from, or the surgical illnesses the person is suffering from, or psychiatric illnesses the person is suffering from. Dear ANM members, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one particular topic that you would like to hear in the coming days? Mention in the comment box below. And if you're liking this particular video, then put a thumbs up and spread this particular video to maximum number of true Ayurveda lovers, so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video.